Hi, everyone. All right, folks. Let's see, is anyone with us right now? There we go. People are joining. Excited to do this live with everyone. And it looks like Brandy joined in as well. All right, folks. So what I will do here is I'm going to wait just a minute or so until we get everyone on here because we're supposed to start. The story goes, we've done lots of lives in the past, but we have never done a live with with one of my former patients. And there she is, Brandy.
Hey, how are you doing?
So good, so good. I'm so excited. Just got done with surgery and then perfect timing for this live. It's amazing.
No, I'm super excited about it too.
Yeah,
Super
no,
excited.
this is going to be great. So I was just telling everyone, so what we're going to do is do something we've never done before, which is talk to one of my former patients. And you are the first one we're doing this with, mainly because you've been so amazing in terms of interacting with our community and being such a great, representative of the surgery and the whole concept of facial rejuvenation and the personal empowerment that goes along with that in terms of being able to take control of whatever path that aging is taking you on and say, you know what, I'm going to do something about it, and which I think exemplifies a lot of the philosophies that we have in general about this stuff. So what I thought we would do is basically ask you questions,
That sounds
and
good. I'm
yeah, and
ready.
just let you kind of lead the way here. So basically, this is what I want to learn a little bit from you and for you to share. So you were 48, was it, when you and I met? Is that correct?
Yes, I think when I first came in for the consult, I was 48 and I got it done the year I was turning. I was 49 and turning 50 at the end of that year.
Got you. So what was the motivation, the changes, the things that you were starting to notice in yourself that kind of led you down this path? To kind of take us through that history from whenever that started to the things you tried before until you finally, got
Sure.
to this point.
No, I had always taken really good care of my skin. So that was something I had always done. But then the older I was getting, I would say probably in my late 30s, I just started noticing just a lot of my jowls were kind of starting to droop down a little bit. It wasn't that bad. So I kind of, was doing a few other things. So I went in and I had like some fillers done. I felt like that worked for quite a while in my later 30s and into my 40s a little bit. But what I started to notice as I was kind of going into my mid 40s is that the more filler I was having put in, and I wasn't really even that dramatic with it, I was just kind of doing it subtly. But over the course of time, what I started to notice is my face looking more heavier, almost kind of bloated, very full, but it just didn't have a nice natural look. I looked heavier. And as a matter of fact, after I had surgery, a lot of people said, you must have lost a lot of weight as well. And I said, I didn't lose any weight, but I could see why that would appear that way because my face did look just so much more
Yeah.
heavy just due to all the filler. And so I kind of was just becoming more unhappy with it. And I'd always kind of thought, maybe when I'm a little older, I'll have it done. But I was approaching my 50th birthday and I thought, well, this is probably a great year to have it done. So I got in contact with you. I did a lot of research. I looked at a lot of different surgeons. There's a lot of surgeons even here in the Arizona area that have, good recommendations. But there was something when I came onto your page, started going through just the website and talking to your staff that I just felt so comfortable. And I knew like it was very quick for me that I knew I had a friend that actually recommended me. She's like, this is the guy you need to look at. And as soon as I started looking and I just kind of was like, okay, this is it. So that's kind of how I went down that road. It's just kind of a process. I did threads at one point, which I just wasn't very happy with. It was just a lot of things. And I was spending a lot of money. And I thought, I'm spending a lot of money, but I'm not happy with the
Yeah.
results either. And
Yeah.
I knew that if I just moved forward, with surgery, that it would be, a much more, a longer, e- everything. And I knew that the filler, all of that would be taken out and we'd kind of start fresh again. And so that was like a great thing for me too.
So it's, you brought up some really good points, and I'm just going to circle back on them so that the audience understands it a little bit. So the experience that you had in your 30s where the fillers were doing something positive, and then they became less and less effective. And that's something that I noticed, as I was treating patients back in the day when I was using fillers and things like that, that there was this, positive effect when you're treating somebody who's younger. And that positive effect comes from the fact that when you're in your 30s, you're starting to lose a little bit of volume, but you haven't started to sag yet. It's just volume loss. So you put a little bit of volume back and you look great. You look kind of good as new. And then what happens is, as you get into your mid 40s, things start to sag. And when things start to sag, that's when fillers don't do the trick anymore. And that is like constantly changing, right? It's like getting worse and worse year after year.
Yes.
And the fillers start to make you look heavier because you're putting it in places that actually it doesn't necessarily belong, like in the cheeks or the jawline or whatever. And it actually, as the face is coming down, it makes it look bigger and fuller, but in the wrong way. Right. And so your awareness of that was spot on. And I always say, and I think I've gone full circle with this too, because I think just like everyone else over the last 20 years, I've tried all that stuff. And eventually you realize that it's just not the right tool for the person who's in their late 40s or early 50s. Yes. And ultimately now I think the moral of the story is that surgery is simply the only way you can take up laxity and neck looseness and, all that kind of stuff. And so let's talk a little bit about the, one other thing I want to say is for everyone out there, it's so important what Brandy mentioned, to feel comfortable with the surgeon that you're potentially going to do this with, because it really is a relationship at the end of the day. Because everything generally speaking, goes right and you expect it to. But if you've got an infection after surgery, if you've got a hematoma after surgery, you got something that you need to discuss with your surgeon, you need to feel that you have a relationship, and it is a very positive relationship going both ways. So that's a really important point you brought up, that you felt it in your heart and your gut that this was the right person for you, and then you move forward. So let's talk a little bit about the surgery. So we got you all scheduled up. You're starting to become more and more aware of the changes. Talk a little bit about what the surgery was like for you.
I remember coming in and I remember people saying, "Are you nervous?" And I said, "I'm not nervous. I'm just really excited." I had faith in you and your team. I had met with them. Everybody there was so professional, so kind. I was very comfortable coming into the situation. I was very excited. But I also really took note of the things that you guys had said to me, which you had said, don't have high, we're going to tell you these things. So if you see these, results 2 days down the road, don't panic. This is the process, and you kind of have to trust the process. And so I kept that in mind the whole time. I mean, the first time they unwrap your head and you see yourself, it is, it is a huge shocker. But I also knew, you guys had said, I mean, it's going to look, and you had told me, day 3 and 5, that you're going to have more swelling. And it was pretty much right on spot, exactly what you guys had said. But I kept that in mind instead of getting panicky or saying, oh my gosh, is something not right? I knew you had just said, trust the process. This is going to how it's going to go. And I just was very comfortable in that. Going into surgery that morning, I was very excited. Coming out of it, it felt like it was so quick. And I felt like I could just get right up off the table. And when I remember one of your nurses saying, "No, you can't just walk out of here. We got to wheel you out of here." But I was like, I think I can. And then we drove across the street to the hospital, and I got out and walked in, and I said, I actually feel, pretty good. Yes, you do look a lot worse than you feel. But I was really surprised that the pain level was not, I think I took the pain medication for 2 days, and then I just did extra strength Tylenol. And it was, day 3 we went out to eat at a pizza place with my daughter, and I had a hooded sweatshirt on. I had drains still in the back. I just put the hoodie on. I mean, it really, I was very surprised how really, I mean, it's a hard surgery, but as far as the pain levels go, I didn't think it was that bad at all. To the point where I was, I've got to get out of the hotel. I got to see some things, and we're in San Diego, and there's lots of good restaurants. I think we were eating out every night after that.
Is that
I said, "Oh, they've seen it."
amazing?
Yeah, I said, my husband said, it looks bad. It looks like you've just been beaten up. And I said, "Oh, they see this here all the time. Don't worry about it." So, but yeah,
That's funny.
it was a really great experience. I walked in there. I was excited. I think the most agitating thing was I couldn't wear my contact lenses. So not being able to see for about a week real well, everything was blurry. That was probably the most agitating thing. I was ready to get the drains out of my neck on day 4 or 5, whatever day that came out. I was ready for those to come out. But other than that, and I noticed every single day after day 5, it was incredible, the healing. I mean, it was just like day 3, I looked like an alien almost, like just bruised up
Crazy.
alien. And
Yeah.
by day 5, I'm like, okay, this looks a little better. And every day after that just got better and better.
Yeah, I'm glad you walked us through that, because it really is. It's a very consistent experience for patients. It doesn't vary that much. I mean, really fundamentally, it doesn't vary that much between patients. People's perceptions of the experience is going to be different. Like you had it sounds like an amazing attitude about the whole thing. You did what's so important, which is to trust the process, because it is a process. I mean, and you go through something to get to the other end.
Absolutely.
And the watching your face swell up and get avatar-ish and crazy looking and all that kind of stuff, and then knowing that it's going to be okay is not something that everyone can immediately feel, but you got to feel that ahead of surgery. Whenever you've got that trust in the surgeon that they can, they know what they're doing, they're going to get you through it. It helps a lot going into it. But the some people were asking, yeah, these are done under IV sedation with local anesthesia. It's the way I do it because it's 1,000 times safer than doing it under general anesthesia. And the recovery is a lot faster. The potential complications are, I mean, incredibly minimal. So I've been doing it this way since fellowship. I've been doing it this way from the beginning of practice. And I think it's a big advantage for patients to be able to do it this way. And most of the doctors and even the anesthesiologists that I've operated on over the years have all chosen to do it this way. Pain it's interesting that there's not a lot of pain after surgery. I mean, it really is kind of a crazy thing, and bruising is very minimal. And I think for those of you who haven't had a chance, we have Brandy's healing photos in one of the posts just a few days ago, and you can kind of see, but that's pretty typical in terms of, now the one thing that I would say is generally, like you did, I think I would say better than most in the way is that, and I don't see people past day 7 until they get a little further out, but you look like you really turned the corner on day 8. Most patients, I think, are like between day 10 to day 14 is when they make that transition. But we always say 2 weeks is the point where you can get back to work and doing all that kind of stuff.
Right. Absolutely. And about the IV sedation, I really actually would prefer it that way all the time now. I wasn't sure going into it what it would be like, but it was a really, people ask me that a lot. Was that scary not being completely out? And it was a great experience. And like I said, I literally, when they woke me up, I felt like I could just get up and walk out. Where I've had other surgeries in the past where you just feel groggy all day, you feel, nauseous, all these other things. And I didn't feel that way at all coming out of surgery. I felt very alert. So yeah, I highly recommend it, and I wouldn't want it any other way. So I always tell people, it's a great way to have it done for sure.
I think some people think it's a little scary at first, but it's there. If it was uncomfortable or if it was like nerve-wracking, I couldn't operate on them in that condition. Like it's very peaceful and mellow when we're actually doing the surgery. And I mean, for all intents and purposes, it could be under general anesthesia, but yet it's still like a light sedation, which is interesting. It's a really cool
I remember it kind of as I was coming out of it, you asking me things, and I remember still being out, but I never felt any discomfort. And I remember I could answer you, but I didn't feel any discomfort whatsoever. It's pretty amazing to think that can all be done that way. But like I said, I would never want it done any other way. It was great.
For sure. No, I agree with you. It's a blessing to be able to do it that way. So another question. So tell me a little bit about, this, because you hear me talk about this concept of the, the importance of looking as young as you feel.
Mm-hmm.
That I think that's really at the end of it, 99% of the reason why everyone who comes to me in the first place. They're like, you know what, I'm seeing myself starting to slip away from where I envision myself.
Right.
I did a post a while ago. It's like in our minds, we're like in our 30s or 20s or whatever it is, and yet our age might be 50 or 60 or even 70. Like today, I operated on a 76-year-old, who
Oh, wow.
literally lives like a 20-something-year-old, in terms of physical activity, health, and vibrance, and all that kind of stuff. So age is really just a number. The physical manifestations of age on our face can't be, prevented or controlled. It has to be addressed with something like this. Talk a little bit about what your experience with yourself, from like a self-perception, confidence, all that other stuff. Like, how did that feeling, sort of, how was that for you?
Yeah, I think that was something that was really starting to bother me especially as I came into my 40s. Just as I started to see like that, like I said, my skin has always been something I've taken care of. Um, but on that was something that you couldn't really control. The one thing I was a 1972 baby. So the one thing that we didn't do a lot very well is sunscreen. I mean, we basically kind of went out and, baked ourselves. So I know my face just had a lot of probably even sun damage, wrinkling, just some aging that came from probably that. Those are things that I learned older, when that kind of became more, we became more familiar with the damage of the sun. And so I'm really big on that now. But it was just one of those things where as I was starting to see, I remember watching you and saying, if you're doing this to your face and you're kind of lifting your face, and you was like,
Mm-hmm.
yes, this is what, and I remember doing that and thinking, that's exactly how I feel. It's just like, I didn't want a different
Yeah.
face. I was fine with my face. And it wasn't, and the other thing was, people say, well, you're going to get older. Yeah, I don't mind. I'll be 51 in December. The age thing doesn't bother me. But it's just kind of like you said, as 51, I'm still very active, exercise. We do a lot of, hiking, lots of activities with our kids and our family. And so it was one of those things where I felt very young. But when I would look in the mirror, it was just like, I just kind of want this just to be lifted up a little bit. I don't want a big face change. I
Yeah.
want the same face. I just want it to be freshened up, just lifted back up and kind of, and that's when I was looking at a lot of your before and after photos. The thing I noticed is that your patients, it didn't change their look. It just made them look like a little bit more like a refreshed
Yeah.
version of
Like a
themselves.
younger
And
version
that's
of
what I
themselves, but
wanted. I didn't want to
different.
come out and people say, oh my gosh, what did you do to yourself? You don't even look like you. I wanted to look like me,
Yeah.
but I wanted just to have a little bit of that lift. And yeah, it was, once I saw the vertical restore, I'm like, this is it. This is the
Yeah.
surgery I want for sure.
I think the really neat thing about the vertical restore, and just in general, I mean, I think that's the whole reason why people come to me in the first place, is to look like yourself, but a younger
Mhm.
version of yourself,
Yes.
without looking like you've had surgery. I mean, looking at you right now, it's like you just look like like if you didn't know you had any surgery, we were talking about, I don't know, gardening right now or something like that. No one would suspect that you've had any work done. And that's
Mm-hmm.
the beauty of the, the technique and the approach, is that it leaves people not looking like they've had
Right.
any work done, which no one, I think, like, looking like you've had work done is worse than looking like you're aging. You know what I mean?
Right.
That's
Right.
the
That
thing.
I agree 100%. And you see it a lot.
Yeah.
Different Hollywood stars, and it's just like you think, oh my gosh, they needed to go to Dr. Karam because they had a really great face, but they come out and they look so different. And that was the one thing I'm like, I don't want that at all. I want to come out and still look like myself, but just a younger version, a little bit, refreshed. And so that, absolutely, like you said, that you just you feel and look the same, and that those two things aren't off
Yeah.
balance. And I felt like they were off balance. Like I felt young, but I really could see the aging taking taking place in my face and neck. And so I just wanted to get that taken care of. And I had thought about, well, maybe when I'm a little older. But then I thought, why wait until
Yeah.
you're older and then you've got more damage and more more wrinkles? It's like, you're
It's
50,
a
you're
lot.
getting up
Yeah.
there, so
It's a
just do
lot
it now and
easier.
enjoy it.
It's so true. It's a lot easier to also get a person to look like they feel like in your mind, you're probably in your 30s or whatever, to make you look like that, as opposed to when you wait too long, you're going to look amazing still, but you won't look 30 again.
Right.
It's easier to do it in the earlier stages. So Brandy, another question I had for you, and this is just like you've been so, you know, and I think we're lucky. We have a lot of patients like this, but you've been so open about your procedure and so open about sharing your experiences and all that kind of stuff. What's been your sort of motivation behind that? Like, I mean, in terms of like, and I think I know the answer, and I'm just going to say it, but I want you to agree or disagree. But most of the people, I always think, oh, they're doing it because they like me a lot or whatever, and they're wanting to support me. But at the end of the day, I think that's a part of it. But I think a big part of it has to do that you're really trying to like show what's available for other women to be able to make those, you know, decisions for themselves, or not get stuck in this vanity cycle. Oh, I feel guilty because I'm doing this, or the way it's perceived and all that other stuff. You're trying to kind of like talk to me a little bit about your your desire to kind of open that that dialogue a little bit.
Well, I think after having surgery, I had so many women that started messaging me about this, and there's kind of a lot of people still feel like that shame behind it, like, oh, I want to get it done, but I don't want anybody to know that I had it done.
Yeah.
And there's just this feeling that they had that it's, people are going to, come down on them about it, or, think it's vain, or, and so there's all these kind of mental things going on in their mind. And I think when I started kind of looking at it, I could see, if I was looking at people's before and afters, I could see before and afters, but I didn't see a lot of in between. And I'm kind of one of those people, I'm pretty open, and it doesn't really bother me to show people the in between. And it was kind of the good, the bad, and the ugly, but it was like, I kind of wanted people to see, because I couldn't really find a lot of that. When I was looking, I could just kind of see the before and afters. And there was maybe a few here and there, but I thought, I'm just going to document it so that people can see really from day, one, walking into your, room to have surgery, and then every single day beyond that as it healed. Because I wanted women to be able to look at it and kind of say, okay, this is what you're going to look like, and yes, everybody's going to vary a little bit, but it kind of gives them a good overview of the process and the healing process, and the pain levels. I talked about pain level. I talked about scarring a lot, mainly for me, because I've always had really short hair. And I talk to women a lot, and I'll say, they'll have longer hair. And I'm like, it's really not that bad. I mean, for me, I keep it shorter. So I had to work with that a little bit more. But as my scars have healed, they've healed beautifully. And I haven't worried about it one bit. I always say to people, if it's a surgery where there are scars, because you're cutting your face, but they fade. Mine have faded really nicely, and the scarring wasn't what I was worried about. I had more concern about the sagging and the laxity in my face than having scars. So that wasn't a problem for me.
Yeah.
And even keeping my short hair, it was something that didn't really affect me whatsoever.
No, that you bring up a lot of good points there. I think helping people destigmatize it and not feel guilty about taking care of themselves and wanting to continue to look the way they feel, but also as you said, just and I think we've had a lot more photos and videos and things like that since we want people to see what it's like to go through it. Actually, it makes my job and my post-operative team's job 1,000 times easier for people to know exactly what they're going through, so they realize that they're not alone when they're swelling up like crazy in the first 3 or 4 days or whatever it is. But just to have trust again that you're going to get to that other point. Just be patient; it'll get there. So and that it's not like torture and all this kind of stuff. But
because like you said, looking at my 8 days, my photos of the 8 days, if you look at me on day 3 and 4, you do not think I'm going to look the way I look on day 8. I was surprised, because I was like, this is not going to be day 8 or 10. Like I was thinking, I was going to be quite a ways out, but I was really surprised. And like I said, it was one of those things where on, day 8, I felt like, oh man, this is like the best results yet. But it's kind of one of those surgeries where, and you had said it early on, where it gets better even with time. And I feel even at 2 years out, I like the way it looks better than 2 years than it did even at 1 year. It just kind of almost keeps gradually getting better, which is kind of a funny phenomenon, but it is really true. It's like your face does take some time to kind of the swelling, you know, and I would think, oh, I'm not even swollen anymore. And then I'd realize, oh no, you actually were still a little bit swollen. But once all that started to settle, I mean, it's incredible. The body is an
It is
amazing thing, how
an
quickly
amazing
it can
thing.
heal like
Yeah,
that.
it's true. It is very, very true. Yeah, I think, people love the results pretty early, but they love it more as time goes on.
Mm-hmm.
As you said, the swelling goes down. So let's switch gears a little bit and talk about your journey with
Yeah.
skin. You're like a typical Southern, were you born and raised in Arizona?
No, I was actually in Northern
Oh,
California.
Northern California. Okay.
Yes.
So, but our era, I don't think I've ever met anyone who wasn't like tanning back
Oh
then,
yeah.
right? I mean,
Oh,
like we're in your 50s now and like
always.
growing, everyone's just, what are you doing this weekend? I'm laying out. That was like
Oh yeah.
what everyone's doing. It was like a crazy, crazy thing. It sounds relaxing though, but terrible for your skin. Okay. So you go through this. At what point did you start really kind of focusing on your skin, and what did you start to do?
I think I was pretty young. I had my best friend, her mom was kind of a skincare person, and she'd take us down to the mall, and we were at the Clinique counter, and they were, giving us little makeovers. And so I think I was probably around 12 years old where I really kind of started doing just the
Mm-hmm.
basic skincare.
Oh, 12.
Um,
Wow.
yeah, so I was pretty young when I started the very, very basic skincare. And then I was also in the era of like, the apricot scrub.
Mm-hmm.
And then you start to realize, okay, this isn't helping. It's like, it's very harsh and very abrasive. And so I was always and I was always intrigued by it as well. Something I enjoyed and liked. I liked skincare, makeup products, trying different things. And so I was always kind of that way from the time I was pretty young. Um, Again, the sunscreen part didn't really come into play probably until I was in my 20s, because at the time, like you said, our era was a tanning era. Like
Yeah.
we were out, but as far as, I think it did help quite a bit that I was always doing, at least the basic skincare. And then as I started to get into my 30s, I kind of started picking up on, probably even my late 20s to early 30s, retinol. That was a big one for me, and that was a game changer. I noticed the whole structure, or the texture of my skin. That's one that it's just, I can't live without retinol product. I love it. But
So that it's so I mean, you say something very powerful there. I think people don't realize. I mean, when you look at you, you got great skin. You have beautiful skin. I mean, you have beautiful skin before surgery. I know we'll talk about the trifecta and all that stuff, but you exemplify, and I told you this when I met you, I was like, when I operate on somebody who has, nice skin and I get their shape where it needs to be, it's like crazy good how that combination works out, because really what makes a person actually look young is young looking skin and a young looking facial shape. Those are the two things. So I've always been really big on trying to get my surgical patients to have great skin, even if it meant after surgery and
yes.
forever, because it just makes my surgical results look even better. So so in this situation, you have been doing like fundamentally really good things for
Yes.
years and years. Like retinol is a huge piece. Consistency sounds like is a big part of your thing for years. So talk to me a little bit about, because I introduced you to the trifecta at one point, but you had, so I'm not taking credit for like how great your skin was coming into surgery, but what made, like, what was your experience like when you switched into the trifecta and all that?
It was really amazing for me because I've always been kind of a product person and really good at taking care of my skin and good skincare regimen and making sure I was very consistent with it. My problem was I had a million products
Mm-hmm.
and I was good at it, but like I said, even all of my friends are like, how can you go? I mean, it's like 10 to 15
Yeah.
steps of things that you're doing. So it's very time consuming. And so when I first saw the trifecta, I was like, this only three things. Like, if this is great, it's going to be really great because it's going to be quick and efficient. And I wasn't sure, not having tried it before, but
Or
I was
yeah.
amazed when I tried it because it's very quick and efficient. Um, the one thing I loved is like the third product, the Illuminate. Like when you put it on, it just gives your face just this really, really great glow. Um, it's amazing. And I can walk out and do, you know, the quench and the illuminate and walk out, and people will always comment if I have nothing on my skin. Oh my gosh, your skin is so glowy. Like, what do you do? And so I get compliments all the time. And I noticed that the compliments, when I started using the products, the trifecta, started coming more and more.
Yeah.
I loved that it had everything that I was putting on in, you know, 10 steps or 15 steps in 3. So it's, you know, it just cut a huge part of the time that I was putting into it out. If I travel, it's easy to travel with. I'm not having to pack up all of these things. It just, it's so much more simple.
That's
And I
awesome.
love it. I absolutely love it.
And you've been on it for 2 years now.
Yes. Yes. I
That's,
started it pretty much right when it came out, because that was about the
yeah.
time that I was coming in. So I think it was maybe just a month or 2 before that I came in for surgery. I had started it. So
Well, I mean, that's all. And we have a bunch of people who've been using it for a couple years now, and the comments are that their skin just keeps getting better and better as time goes
it
on.
really does.
Yeah.
I agree with that.
And
I
I
agree.
think it makes sense, because if you're finally able to do all those key pieces, you know, the retinol, vitamin C, niacinamide, you know, all these different aspects of like hyaluronic acid, all the things that are going to lighten discoloration and improve oil balance and shrink pores, and all of it together, your skin's only going to get better. I mean, anything in life, if it's the right thing and you're doing it regularly over time, it's going to get better. So it's been awesome for me, because it's made my job actually a lot easier too, because I used to spend, I'm not kidding, about 45 minutes discussing these, you know, skincare with our patients after surgery. It was like the 3-month appointment. I would try to get them lined up on all the different components, and it was like a minimum of 8 to 10 steps.
Yes.
And then it was so disheartening, because you come back after, you know, a few months, and no one's on those steps.
Right.
It's like too much for the majority of people
Right. And I would
to
think
do
for the
that.
majority of people, they're not going to do the
No,
10 and
no,
15 steps. I did do them very consistently, but I'm
yeah,
not going to lie. When I was able to take it down to 3 products,
it's
and
not.
I was like, this actually works and does
Yeah,
the same, if not better. And I actually think better. Then I was like,
yeah,
this is like, it's golden. Like, I love it. And I recommend it. It was always hard, because I've always liked to help other people, or when people would ask, but then you tell people and they were like, oh, I can't do all that.
yeah.
And this is easy. You can recommend it to people and they're like, oh, that would really, that's simple. And it really is that simple. I love it. It's
That's
just
awesome.
been, yeah,
Well,
I recommend it all the time.
you've been. I know I invited you to, and this invitation is open to anyone who's on the call. You know, that are active users and want to help get the word out. But you've been part of our ambassador program from the beginning, which basically
Yes.
just means you're helping, you know, people get the word out about it, and learn about it and all that kind of stuff, because it's hard to know what to do, especially when there's so many different choices out there, you know?
Yeah, there's a lot, and it can be really confusing.
Yeah.
And you know, and when you're trying to deal with, and people, you know, that are my age and have never done skincare, and I'm surprised how many I run into all the time. That's, you know, they're like, I know I need to start something. I'm, you know, in my 40s or my 50s, and all I've ever used is like Dove soap on my face, and you know that I need to start something. But
Yeah.
when you try to tell somebody who's been just using Dove soap on their face, oh well, here's 15 products,
Yeah.
it's overwhelming. And
Totally.
like you said, I don't think the majority of people will stick with that or be dedicated to it.
Yeah.
Where when you say, here's 3 products, and one of them is the cleanser, so
Yeah.
that's real easy. And then the
Yeah.
other 2, you know, they're amazing. They're great products. And like I said, everything that I was putting on before is all wrapped up in just the 3 products. It's so simple, and yeah, it's great.
That's
I
all.
love it. I
That's
recommend it
all.
all the time.
No, it's amazing. I mean, your skin literally, it's like so beautiful, glowy. I got to a point now I can, because a lot of my patients who I meet for consultation are on the trifecta also. Like, I don't even ask, like, what are you doing for skincare? I actually just ask, like, how long you've been on this trifecta for, because there's a very distinct glow
It
that
is.
happens. And, you know, it's like 95% of the time I'm like, right when I say that, they're like,
Yeah.
oh,
Oh,
I've been
I
on it for
agree.
however many. Yeah, it's
Yeah.
interesting. It's interesting.
Yeah, because most of the time, if you're trying to get a glow, you're having to put on like an illuminator or something, you know, a
Yeah,
makeup product to get
yeah,
that. But literally, when you use trifecta, the last product, the Illuminate, it literally does just
Yeah.
give your face this really amazing glow, and I love it. It's absolutely amazing.
That's interesting because I mean, when I was thinking about what to name it, like there's a quality of skin, which is the way that it reflects light, you
Mm-hmm.
know, and that luminosity is basically what it is, the ability to radiate light off the face, like bounce.
Mm-hmm.
And that was the look that I wanted the skin to have, is like a really healthy, youthful look to skin. And
Yes.
yeah, I mean, it was pretty awesome. But the other piece I want everyone to know is, like, you know, Brandy was on one end of the spectrum where she's been, you know, very actively taking care of her skin from the beginning. But anyone at any age, I mean, I'm not kidding. I had a 78-year-old guy, believe it or not. He was a husband of one of my surgical patients that I operated on not too long ago. He started it, and he was like saying how much he loved it. Like, at any point in life that you start it, it's not too late to start taking care of your skin. That's
No.
the final moral of that story there.
Yeah, and it works great for men too. I've recommended
Yeah.
it to men friends of mine, and it works great for men and women. But yeah,
Yeah, it's
they're
really beautiful.
great.
So, Brandy, I'm gonna open it up to some
Okay.
questions, and let's see here. Addie's got some questions for us. She's just been kind of collecting them as they go out. So,
Okay,
we'll
perfect.
Addie, do you want to ask the question, and I'll rephrase it?
Yeah. So the first question is for you, but it was about Brandy's surgery. Did you dissolve any filler before, after, or before or during the surgery?
So, Brandy, remind me, did we take any of your fillers out from under your eyes?
I had actually had it done, and then I think I had about a 14-month wait. And so you had just said, don't get any more.
Yeah.
You're going to be in here in about 14 months, let it dissolve. And I remember that when you went in, you said there was hardly anything
Yeah.
there. But I just kind of stopped when I knew I had about a 14-month wait
Yeah,
right
you just
there.
let
I
it kind
just
of
didn't do
work
any
out.
more. And you said you didn't have to
Yeah.
mess with it at all.
So here's what I tell people. I only remove it under the eyes with enzyme, you know, when they have it there. I don't want it removed out throughout the face with the enzyme, because it tends to get lumpy bumpy. And then you go do surgery, and then it becomes lumpy bumpy. So we want to let the fillers, like in your case, go down as much as they can, but evenly throughout. And when I'm doing the fat transfer under their eyes, I'd like to have that removed.
Yes.
Yeah. What other questions?
A lot of people are asking if Brandy would be so kind to show her incisions. And with that question, they also were wondering if she experienced any numbness.
So, Brandy, did you have any numbness post-surgery?
After surgery, yes, I did have some, for sure, but it was, it's typical kind of.
Yeah.
I'd had years ago, I'd had a tummy tuck procedure. Same thing. It was kind of numb for a while, but then you just kind of, as the nerves kind of regenerate, you start getting that feeling back.
Yeah.
So I would say the first few months, you definitely could feel it, but it wasn't anything that was problematic.
Yeah.
You just, it was noticeable to me.
Yeah.
But it wasn't anything to me that I thought was really bad. But now, I mean, 2 years out, I have none.
Yeah.
And I don't even think a year out, I don't think I had any. I think it maybe within maybe 4 or 5 months that, and certain places started getting feeling back sooner. But within, I would say 4 or 5 months, could feel anything. It wasn't
Yeah.
any numbness.
And I think a lot of people need to kind of know that, like, numbness is not a complication. It's going to happen. You have to. I mean, you do surgery on any part of the body, and the skin is cut. There's going to be numbness around that area. In this type of surgery, I mean, you're going under the skin and doing, the things we do. So all those little nerve endings that are going to the skin, they're going to get temporarily, cut basically, and then they're going to have to resprout. And that resprouting takes a little bit of time,
Yes, but it wasn't anything that was problematic or caused any, discomfort, or it's just kind of, again, it's kind of the process. You just kind of knew that as the nerves kind of became regenerating again, that you started getting that feeling back, and it was nothing nothing problematic whatsoever. And my incisions are for short hair. They're from here. And then I have under my chin. Yeah, I don't even notice the one under the chin at all.
So just for everyone, so that you know, like, the incisions don't change that much for I've done a lot of variations of it over the years, but basically the approach I take now is I go along the hairline, you know, so that, in fact, well, it's too close. I won't talk about. I'll actually do a post on incisions later in terms of hairline and not hairline at all. But I make it right at the edge of the hairline. I go behind this part of the ear, then behind this here and down here. And that there's a rationale there that you preserve the shape of the hairline so that you don't lose, you know, hair going this way. And really, really importantly is closing this part of the incision really well so the anatomy of the ear doesn't get distorted.
Right.
And because, you know, the vertical restore is foundation is on a deep plane, the tension is not on the skin, so it doesn't pull the ears down. It doesn't pull the scars open and making them wide. So it really has a very, very natural look overall, and the incisions kind of like in the worst case scenarios are like a thin line,
Yes.
if anything. Yeah.
Yeah, I would say mine, you know, because of the way I keep my hair, it's, you know, I have to kind of, you know, push my hairline. And again, they're very fine and they're very flat.
Yeah.
And if I really wanted to mess with anything that's there, you could touch it up with a little bit of concealer.
Yeah.
It's not ever been problematic or not anything that I've been self-conscious of.
Yeah.
I do get the question quite a bit though about the lift, and people will ask me, you know, oh gosh, you still have a pretty good scar there. Well, your scar looks really amazing. You can't see it underneath my nose here. But
Yeah.
I had a dog attack when I was a child that bit through my lip. So a lot of people were thinking, oh gosh, that's part of the surgery. And I'm like, no, that's just a scar I've had since I was, I think, 7 or 8 years old.
Yeah.
And so that is just kind of an old scar. I've got an old scar here. I was having my face stitched up quite a bit as a child. I was always having something.
You're troublemaker.
So yeah, so those are 2 scars I've always just had. But yeah, the lip lift as well is just like right along the nose line, and it's very easy. I mean, it healed up really, really nice.
Yeah.
No,
and that's honestly, and I think the rule of thumb is, if you don't want any scars, don't have a surgery like this. Don't have any surgery, right? I mean, that's all there is to it. But most people, I would say 99% of my patients feel that treating the jowling and the laxity and all the other stuff that's related to aging is far more beneficial and impactful than having a thin, you know, scar left behind. Like, it's just, I mean, most people even, they perceive it the way you do. They're like, it's not even a thing that affects what I do with my hair or whatever, you know, it's that kind of deal. So
right. And I thought the same thing. It's like, I would much rather have a little scar that I have to kind of, you know, maybe mess my hair around a little bit than have to deal with the sagging and the jowling and my neck, you know, the sagging in my neck. And I'm like, oh yeah, that I can deal with this all day long. I just wanted this part lifted. And so that was just a small thing for me that I knew I would have, but I was okay with that. And I think if you're, you know, like you said, if you're not okay with the scarring, you're probably just not ready for surgery yet, because
100%,
you'll hit that place eventually that you're like, okay, now I'm ready for it. But
it's like, it's like if you have a bad knee and you have to have, you know, ACL surgery or repair or something, if it hurts bad enough and you're limited enough, you're like, okay, I'll take that scar. But, you know, obviously we do a very, very delicate and deliberate job of trying to make those incisions as concealed as possible. But the thing is, I think what's really also kind of back to this scar issue, because it's a deep plane approach, there's 2 advantages. I mean, it's not a deep plane in the sense that it's not like a typical deep plane. The vertical restore, just so people know, it's a combination of 4 different areas we're addressing: the lateral brow, the mid face, the jawline, and the neck. And compared to a deep plane, the whole thing is tilted much more vertically. So it kind of, it's that motion that people do when they go in the mirror and they're like, oh, this looks like I used to, that type of thing.
Yes.
And because it employs a deep plane, it focuses, I mean, it uses, the results are much more durable than any other style of facelift, like a SMAS facelift, you know, all these other techniques. Nothing is as durable, as long lasting as a deep plane. I mean, that's just been a fact since the mid 80s when the deep plane was developed.
Right.
That it's a difficult procedure to perform, but it gives you very, very long lasting results. So that's a really cool thing. Once you get it, you're kind of like, okay, I'm good for a long time after that. But it also means that the scars heal really well because all the tension is kept off of the skin. So that's a
Yes.
really, really good thing.
Hmm.
Yeah, all around. All right, you have another question for us, Eddie?
Yeah, so some of the viewers were wondering how the surgery affected her confidence and also how sharing her journey has affected her
Oh
confidence.
yeah, that's an interesting question. So how did it affect your confidence and also sharing your experiences? How did that affect, your sense of self or confidence and all that stuff?
Yeah, it was one of those things for me. I knew, like I said, probably going into my 40s, and when I started to see that those changes and that the doing fillers wasn't gonna be a long-term thing, I knew. I kind of started looking at, maybe when I'm around 50, this is something I'm probably gonna look into. And so it was one of those things. I had thought about it. I think it's something that, if you think you're gonna get the acceptance of everybody, you're not going to. You're going to talk to your friends about it. Some are going to be really excited for you. Some are going to say you don't need that. You're going to you're going to get a mixed bag of people coming at you, and you have to just kind of tune all of that out and
Yeah,
do what feel great about, and what you're wanting. And for me, it was just something that was really bothering me, especially I think because I've always liked kind of the whole industry of beauty industry, makeup, skincare. It was something that I always kind of enjoyed anyway and liked that. And so I kind of knew what my options were because I'd always kind of looked into those things, and I knew, I'm like, this can get taken care of, and I'm going to take care of it. And
yeah,
so again, it's one of those things where you can't really listen to a lot of outside forces, because you're just going to get a mixed bag of, a lot of
so
people are going
true.
to tell you you don't need it,
Yeah,
you're
yeah,
fine, that's not something you need. But it's one of those things that, for your confidence, I think it's a great thing, especially when you're feeling that, like we had talked about earlier, like you feel young, but you're like, I kind of want to look as young as I feel again.
yeah.
And again, it's like, that, you're still aging, but that's okay. You just kind of have a little bit of a fresh start, and it's a great thing, especially when you're, I think, in your 40s and 50s going into that. It's a big confidence booster for sure.
I always think creates also a sense of hopefulness about where things are going in the future, right? Because when you see the aging process happen, and you also kind of extrapolate, how it's going to eventually look, like if you don't actually try to do anything to stop it or change it or whatever. For a lot of people, that's a hard pill. It's a hard thing to accept, that that's kind of where
Yeah.
it's headed,
Yes.
And when you get something like this done, it's kind of like, okay, aging in the decades that are going to go by, everything's going to be okay. Like, I mean, I'm going to be able to continue to be myself, feel like myself,
Yes.
and all that stuff, knowing that you're kind of braced against the future aging that comes. It's a very interesting family. We could talk a whole hour on the psychological effects of that,
Hmm.
but I think at the end of the day, what you said was spot on. Like, you're doing it, and anyone who does it is doing it for themselves.
Right.
I always laugh because, so I get these husbands in the
Hmm.
room with them in the consultation, and the husband is being very sweet. He's like, not even like sweet as in trying to like just be sweet. He's just really, this is how he felt. Like, sweetie, you don't need to do
Hmm.
this. I love you the way you are. This is all. And the wife looks at him and is like, I'm not doing it for you. Like, this has nothing to do
It's
with
so
you. Like,
true. It's
no,
so
this is like,
true. It is. It's really
it's
something for yourself.
yeah, it's
It's like the
totally,
best form of like self-care ever. It's something that you're doing for yourself.
yeah,
And it
yeah,
does. I mean, it's like I said, it's like you're kind of at that age, you're going through a lot of, women are kind of going again through another hormonal
yeah,
shift of, perimenopause and menopause. And you just have all these things kind of going on. And if you can, if it's something that you want to do, it's a great thing. It just kind of makes you just, like, it makes you feel amazing.
yeah.
And I have not one regret of doing it, not one. People ask me that a lot too. Do you have any regrets? And I always say not one regret whatsoever. It's been an amazing experience all the way around.
Well, I appreciate that, and I think on that note, we'll conclude. But I mean, Brandy, this has been so great to get your insight and your personal experiences through this. I mean, I think this is something that hopefully the community will really appreciate and enjoy, because like I said, you've exemplified openness, authenticity, just doing everything for the right reasons. And it's been such a pleasure for me to be a part of this journey with you, and such an honor for me to be a part of it as well. And I look forward to continuing to interact with you over the years to come.
Yes, thank you so
Yeah.
much. Well, I wouldn't be here without you. So you
Uh,
did a great job, and I all the time I'm saying that. I'm sending people to your Instagram all the time because I get asked about it, or or I've even had people recognize from me because they've seen me on your, and yeah, they'll ask oh my gosh, wasn't it? I tell them the same thing every time. No regrets. It was a great experience, and not just you, but I've said it a million times, your entire
yeah.
team and staff are just amazing, amazing. They make you feel so comfortable. And
Yeah.
yeah,
We're really lucky. We have an amazing team. I mean,
very much.
that's probably one of the I would say the biggest cherry on top is having to deal with them in addition to having the surgery. It's just such a cool thing, such a blessing. Well, you better come down and see me next time you're in San
I
Diego.
will for sure. I will. We come down there quite a bit, so I definitely will stop by next time I'm down there.
Awesome. Well, thank you everyone for tuning in, and Brandy, thank you again for joining in and
Thank you for having
sharing
me, Dr. Karam.
as always.
I appreciate it.
Thank you
Thanks
so
a
much.
lot.
All righty.
Okay. Have a good. Bye.
Bye.
Bye, everyone.